and welcome to Wellness Watch, a special show curated to ensure a healthy you. A show that explores the health challenges and ailments that affect people irrespective of nationalities or ethnicity. But the catch here is to acquaint you with a wide array of possible treatments and medical procedures India offers for these ailments. Reliable, cost-effective treatments of international standard in India is not a distant dream now. So let's embark on this medical journey with me each week. I'm your host, Preeti. Miguel de Cervantes had said that every tooth in a man's head is more valuable than a diamond. Our teeth have such an important role to play in our lives. They help us chew and digest food, they help us to talk and speak clearly, and they also give our face its shape. Properly aligned, clean and healthy teeth can improve one's overall appearance, while missing or damaged teeth can have the opposite effect. A smile also has other day-to-day benefits. It can give us greater confidence as well as influence our social lives, careers and relationships. Because of this, it only makes sense to give our oral health the best care possible. Today in Wellness Watch, we discuss dentistry, the branch of medicine focused on the teeth, gums and the mouth. Dental problems affect millions from children to adults, yet they're often overlooked. Poor oral hygiene is not just about toothaches, it is linked to serious health issues like heart disease and cancer. But there is hope. Here's up next a report that uncovers the root causes and simple solutions to protect your oral and overall health. Take a look.
Dental problems are among the most common health issues worldwide, sparing neither children nor adults. These issues come in various forms: persistent toothaches, tooth decay, discoloration, and sensitivity to hot or cold foods. But what causes them? In most cases, it's simple neglect of proper oral hygiene. People love indulging in flavorful and sweet treats, but many forget a vital step after enjoying their favorite foods: cleaning their teeth. This oversight allows harmful bacteria to thrive, causing plaque buildup, cavities, and gum diseases. What's alarming is that the impact doesn't stop at mouth. Poor oral hygiene is linked to severe health risks, including heart disease, cancer, and diabetes. Yet, dental care remains low on most people's priority lists. Symptoms are ignored, and trips to the dentist are delayed, often until the pain becomes unbearable. This negligence can lead to a tipping point, a moment when dental problems escalate into serious health issues. A simple cavity can turn into an infection, affecting the body's overall health and quality of life. The solution lies in prevention. Establishing good habits early, such as brushing twice a day, flossing, and regular dental checkups, is crucial. A balanced diet and avoiding sugary or acidic foods can also safeguard your smile. Oral health is more than just aesthetics. It's the cornerstone of overall well-being. Start taking small steps today to avoid bigger problems tomorrow. Harshita Oberoi reporting for Wellness Watch, DD India.
Oral health is the state of the mouth, teeth and orofacial structures that enables individuals to perform essential functions like eating, breathing and speaking. Oral health varies from the life course, from early life to old age. It is integral to general health and supports individuals in participating in society and achieving their potential. However, according to WHO, oral diseases are the most common non-communicable diseases worldwide, affecting an estimated 3.5 billion people. Common dental problems that affect people across various age groups and backgrounds range from tooth decay, gum disease to oral cancer, and these issues can significantly impact overall health and well-being. Today in Wellness Watch, we ask some very prominent questions. What are the various oral diseases? What activities cause oral diseases? What preventive care should be taken? And what special care has to be taken in different age groups? And also, we will focus on the treatment options available in India. India has gained a stellar reputation over the past decade for providing high-quality medical services at affordable cost, attracting patients from around the globe. Dental treatment in India is extremely popular all around the globe for its world-class international standards and the use of most advanced procedures. Up next on your screens, we'll get you the hospitals and institutes, some of them, which provide world-class dental treatments: Maulana Azad Dental College and Hospital, Delhi; Air Force Institute of Dental Sciences, Bangalore, Karnataka; Government Dental College and Hospital, Ahmedabad, Gujarat; St. George Hospital, Mumbai. So these are a few of the medical colleges and hospitals in the country that provide medical treatment, world-class and reliable medical treatment with regard to dental procedures. All right, to discuss more on dental problems, we are joined in by two guests in the studio today. We're joined in by Dr. Vijay Kumar. He is Additional Professor, Conservative Dentistry and Endodontics, Center for Dental Education and Research, AIMS, Delhi. And we're also joined in by Dr. Seema Yadav, Senior Professor, Conservative Dentistry and Endodontics, Maulana Azad Institute of Dental Sciences. I welcome both of you this afternoon on the show. Thank you so much for joining us. To begin with, Dr. Yadav, I would want you to acquaint our viewers with what are oral diseases.
As you know that 3.5 billion people are affected by oral diseases. These diseases can be dental decay, which is very common, and it is a chronic disease affecting children and adults. It is prevalent, but it can be prevented. There are gum diseases which can lead to tooth loss. There are millions of patients who have loss of their natural teeth, and their oral cancers are rising. Dental trauma, dental discolorations, and teeth grinding, which is very prevalent for our dental diseases. But the thing is, these diseases, the root cause of these diseases is stress. Stress leads to the different diseases in the oral cavity.
Okay. I would want you to add to it, Dr. Kumar. When we are talking of oral diseases, what activities in our day-to-day lives do have a bearing on the oral diseases? What kind of activities which we do in our day-to-day lives cause oral diseases?
Yeah. See, there are a lot of factors which affect our oral health. So, first and foremost is the way we eat, the type of food we eat. Okay, so the type of food that we eat has an impact on our oral health. And the oral hygiene measures that we take, like brushing twice a day, are we brushing properly, what is the type of toothpaste we are using, does it have certain component which help in prevention of decay, does it have certain component which helps in maintaining the oral health or the gum health, and there are certain parafunctional habits also that we inadvertently do. Okay, we are unaware of those things, but they are affecting the dental health. Like sometimes we while sleeping grind our teeth. Okay, sometimes the people have habit of nail biting. That is also affecting our teeth as well our temporomandibular joints. So these are the things which overall affects our dental health.
All right, so these are the day-to-day activities which affect our dental health. But then, what are the early signs of dental trouble, Dr. Yadav?
The patient may complain of tooth sensitivity. There may be toothache. There may be bleeding from the gums, or there may be swollen gums, ulcers in the oral cavity, dental wear. Patient may not be aware of the dental wear, but when he visits to a dental clinic, the dentist will make them aware that the patient is undergoing dental wear. So these are the signs which are to be taken early, because early intervention will prevent further progression. So as you visit a dentist, check the smaller problems before they become longer or bigger one. So tooth sensitivity is basically because of the inflammation in the pulp. Whenever there is dental sensitivity, it may be because of cold or taking hot beverages. Patient might have sensitivity. These might be because of the small cavities which the patient might have developed, or there might be little bit of cracks in the tooth which have built up. So these are the reasons, or a patient might be on the tooth brushing habits may not be proper. So the toothbrush habits, in case if he is using excessive forces on the toothbrush, that can also leads to cavity, and those cavities can leads to tooth sensitivity. So these are the early signs that the tooth may get involved with inflammation of the pulp, because the central area is occupied by the pulp where the nerves and blood vessels enters into the tooth, which nourishes the tooth. So in case if it is inflamed, then that means the tooth will go towards the degenerative process. So we have to preserve the vitality, that is the pulp has to be preserved at any cost to make the longevity of the tooth. So tooth sensitivity, tooth pain, bleeding from the gums, swollen gums are the early signs. Or there may be for cancers, you may have ulcers in the oral cavity, you may develop lumps in the oral cavity, which may be the early signs of oral cancers. There may be difficulty in speech, there may be difficulty in swallowing. So these are the early signs which can be patient is grinding. So dental wear which is there in the oral cavity, which a dentist can see and make the patient aware that he is undergoing excessive pressure on the tooth. So dental wear can be checked, which is a very important cause of gradually, and because aging, lifestyle factors and the dietary habits have an effect on your dental tissue.
Okay, ma'am, very aptly you've explained, but then I would take that forward to Dr. Kumar. How often do people resort to home remedies, cloves for that matter, using mustard oil on gums, something of that sort? Does this really help? And when is it the time to see a doctor, a dentist in particular? Because ma'am says that people will not realize that dental wear is happening, but until and unless they go to a dentist. How often and when should we see a dentist?
Yeah, so it is very good thing that in our country, a lot of people, they resort to home remedies.
Yes.
Okay, so if somebody has pain and so there are various remedies people apply, so which are not apt, and they can harm also. Sometimes they, if I may say, they use some clove oil, or they can use some even the petrols, and also these are something which are very dangerous. They can have effect on the teeth and the surrounding structures. So what we suggest is one should at least every 6 months visit to a dentist, get a regular checkup done, and once a dentist find there is some problem, they can advise the treatment at that particular time of point. So it is better to visit the dentist every 6 months, and as far as the home remedies are concerned, we suggest not to use any home remedies. Please visit the dentist as soon as possible.
Okay. Ma'am, what kind of preventive care has to be taken when we talk of oral diseases? Get us more on that.
See, the oral hygiene has to be maintained. The oral care is about oral hygiene. What is oral hygiene is tooth brushing. Tooth brushing twice a day for 2 minutes, that will remove the plaque and the food debris. Then flossing is essential. Flossing removes the plaque from the interdental areas between the tooth. So it helps in removal of the plaque. Brushing only touches 60% of the tooth surface area. So it is mandatory, it is essential to use floss. At the same time, you have to visit dentist regularly, because dentist will make certain things which are undiagnosed or which are untreated. So the dentist will do the early intervention so as to prevent further progression of the disease. So these are the mouth washes, but mouth washes are not a substitute for brushing and flossing. So these are the important areas, or brushing, flossing, rinsing and repeat. So you have to do these procedures, oral hygiene procedures, to maintain oral care. Oral health is not about smile, or it's not about teeth. It is about the
It's an overall-
complete
yes.
health, well-being of the patient. It's the gateway. The oral cavity is a gateway for oral health of the body.
All right, Dr. Kumar, when is it that for children we need to take them to a dentist?
Yeah, so for as it is important to take care of adult oral health, it is important to take care of children's oral health also. So as soon as the child is born, so we need to start taking care of their teeth and their oral cavity. So because there are gum pads are there, although the teeth are not yet developed in the oral cavity, but yes, we need to clean the gum areas so that that will not act as a substrate for the bacteria to grow, and which can in future damage the teeth. So it is important to get the oral checkup done for the child at least every 6 months, and as soon as the first tooth is developed, you should take the child to the dentist. Okay, and there are certain application which we do, certain chemical which we apply, so that the decay will not happen in those teeth. So there are certain time points like at the birth, 6 months, 1 year, and these are the time duration you should take the child to the dentist. And also sometimes there are problems like child is having tooth eruption and there is pain in the oral cavity, so we generally ignore those things. So we should not ignore any problem for the child in oral cavity. We should take them as soon as possible.
Okay, ma'am, you were talking of oral cancer and how it can be, it can spread. Can it in fact spread to other parts of
Yes.
the body as well? What are the early symptoms of oral cancer that we need to watch out for?
I already
Yes, yes.
discussed with the oral cancer can be, I mean, there will be an ulcers in the oral cavity which are not healing. Painful ulcers, lumps, any growth
Okay.
in the oral cavity which is not subsiding, unexplained bleeding. Bleeding may be because of calculus deposition, but even after tooth cleaning, there's unexplained bleeding. Then also you have to look for those changes. Even in case if you have difficulty in swallowing, or is there any change in the speech, your voice, then these are the early signs of oral cancers.
Okay, what are the effects of chronic dental problems on our general overall health, Dr. Kumar?
Yeah. So oral health is also related to a systemic health. So the dental problems and systemic health is interrelated. We can say that there is diabetic patients are there, so they are going to affect the periodontal support, the gum support of the teeth. And it is not like a diabetic patient is having deleterious effect onto the gum support. The poor oral hygiene can also lead to pre-diabetic conditions. It can also increase the risk of cardiovascular diseases and other systemic disease, because the oral cavity harbors bacteria. So these bacteria can enter our body and they can spread to various parts. So it is important to maintain oral hygiene, because there are certain dental procedures also. If we do the procedures, during that these bacteria can enter to the bloodstream, and then they can pass on to various organs and cause various systemic problems.
All right, you're watching Wellness Watch. For our audience who've just joined in, this is this edition of Wellness Watch, where today we are discussing dental problems and how dental problems can affect our overall well-being. And to discuss more about it, we're joined in by doctors in the studio. We're joined in by Dr. Seema Yadav. She's Senior Professor, Conservative Dentistry and Endodontics, Maulana Azad Institute of Dental Sciences, Delhi. And we're also joined in by Dr. Vijay Kumar. He's Additional Professor, Conservative Dentistry and Endodontics, AIMS, Delhi. Ma'am, we are talking of, how in our day-to-day lives we can be careful and cautious, and, we can take care of our teeth. But then also tell us very quickly, are dental implants safe, and when can one consider, opting for dental implants?
See, the dental implants are artificial tooth roots. They are titanium posts which are inserted into the jaw bone, and then once it is inserted, there will be an osseointegration with the post, that is titanium post. So, the dental implants have a 95% success rate. Once it is integrated, then the connector or the abutment is connected to the implant and over which a crown is placed. So, it does not, the adjacent tooth are not affected. Usually, when you replace a missing tooth earlier, the missing tooth are replaced with the help of a bridge where you cut the adjacent tooth and prepare a bridge. But implants save these tooth structure. They do not affect the adjacent tooth. So, one way it is cost effective also. Only thing is with dental implant is your oral hygiene is proper.
Okay.
And the patient should be healthy, should not have any systemic diseases. The jaw bone density should be sufficient for the implant to be accepted.
Okay, very quickly also throw more light onto what medical advancements, what medical procedures are available in India for the people residing not only in India but for people from other countries as well. How popular are dental treatments of India to the world?
See, the recent advances are 3D printing, laser technology which has come up, and digital smile designing and digital imaging procedures which have come up in the recent times, and it is well accepted by the patient because it gives a lot of patient satisfaction as well as comfort.
Sir, you would also add to it?
Yeah, so India is a medical hub and it is now turning into a dental hub with lots of advancement in dentistry. The people from Western countries, they are coming to India because here we are giving them the same quality of treatment and at a cost effective price. Because of our advanced technology, we can offer these procedures at cost effective price. And also there is a trend nowadays in youngster, like they are more excited about their smile.
Yes.
So everybody wants to have a good smile. Earlier there was a time when people used to visit dentists only if they have dental pain.
Yes.
Now the everybody, not even youngsters, the elderly also, they want to have a good smile. So they are visiting the dentist to get the smile makeover done.
All right, so it's not just about pains but also the overall social acceptance, which is a very important aspect when we talk of dental procedures. Sir and ma'am, we will also have a very quick rapid fire question round. So for our viewers to, get some myths cleared on dental problems. Very quickly, I'll ask you questions. Brushing harder cleans better. Is it so, Dr. Yadav?
Brushing harder does not clean. It should be, the brush should be softer and the pressure applied on the brush should be less. Otherwise, it will develop cavities in the oral cavity. It will harm. It will, rather than giving good cleanliness, brush action is to clean the tooth, not to harm the tooth.
Okay. Whiter teeth are cleaner teeth, are they, Dr. Kumar?
No, the whiter teeth are not cleaner because the teeth are can look whiter, but there are certain spaces like interdental areas which can harbor bacteria. So whiter teeth doesn't mean it is a clean teeth. You need to clean the teeth properly because the white is the shade of the tooth. So everybody has different shade. Like we have different skin tones, we have different tooth shades.
Yes. All right. Also, can toothaches or dental problems cause earache?
Yeah, the pain can radiate towards ear, but it does not lead to any ear problem. Because the nerve, the nerves which are supplying the tooth can radiate from the tooth towards the temporal region or towards the ear when it is the upper tooth or the maxillary tooth. But if it is a mandibular tooth, it might radiate towards the neck or the lower border of the mandible. So it does not lead to any ear problem, but it is because of the tooth.
Right.
Because of the tooth problem, it is radiating. The pain is radiating towards these areas.
All right. Dr. Kumar, is teeth scaling harmful or bad?
No, teeth scaling is not harmful. Instead, it is very helpful in maintaining the gum health. Regular scaling improves the gum health and it cleans the tooth structure.
Do sweets and ice really hamper our teeth?
Sugars are real and big enemy of teeth.
Okay.
Yeah, they contributes to cavities and gum disease.
All right. Is tooth loss genetic, Dr. Kumar?
Tooth loss is if we are maintaining oral hygiene. So there are certain dental diseases like periodontal disease. Those are genetic. Dental caries are genetic, but those if prevented early will not lead to tooth loss. So directly tooth loss is not genetic, but yes, there are certain dental problems which can lead to tooth loss if not prevented early.
And teeth whitening to any extent, does it damage our teeth?
It does not damage, but yes, it leads to tooth sensitivity after bleaching. Tooth whitening procedures in dental terminology, it is referred to as bleaching procedures. It decreases the micro hardness of the tooth, and it might leads to post-operative sensitivity. For that reasons, the dentist provides fluoride toothpaste after bleaching.
Okay. Dr. Kumar, primary teeth are not permanent teeth. So, is it a need for them to be taken care of?
Yeah, definitely there is a need to take care of primary teeth also, because they laid a foundation to the permanent teeth. So, if your primary teeth are affected, so once the permanent teeth are erupting, they can affect the permanent teeth also. So, it is important to take care of primary teeth as well as permanent teeth.
Alright, so that was a wholesome discussion on the dental problems and the dental issues we face. Dental problems like tooth decay, gum diseases and also oral cancer are very common these days. However, with proper oral hygiene practices, a balanced diet and regular dental checkups, these issues can be prevented early, leading to better oral health. Education and awareness are crucial in empowering you to take control of your dental well-being, ensuring brighter smiles and healthier lives. Martin Charnin had said that you never are fully dressed without a smile, and a healthy smile is evident of a healthy you, isn't it? On that note, we'll end this edition of Wellness Watch this afternoon. Till we meet next, take good care of yourselves. Bye-bye.